My finger's only this long, I can't quite get in there. Anyways. There are so many misconceptions about healthcare, about medicine, and the perception of a career in healthcare is often so far from reality. Let's react to BuzzFeed's 33 misconceptions about the healthcare industry debunked by the people who work in it every day, and 20 confessions about the healthcare system from the people who work in it. Urology is not only for men. A lot of people think that urologists are penis doctors. I'm a female PA and I work at a practice that is otherwise male provider dominant, and I get questioned regularly about why I work there or why I would want to work there. Just so everyone knows, urology is the study of the urologic system, which includes the kidneys, ureters, and bladder. Every human on the planet has those organs. The penis and prostate are just extra parts when considering male patients. A lot of male patients are insecure about me examining them, despite the fact I do several penile and prostate exams every day. I would like to make it clear that I have nearly an even number of male and female patients that I provide for on a regular basis, and that despite me being a female provider, prostate exams prevent progressive prostate cancer, regardless of whether a male or female provider does the exam. All right, so not quite sure I'm buying that they see 50% male, 50% female, unless this is a very unique practice, because out of the non-sex specific organs, you're looking at the kidneys, the ureters, the bladder, etc. Sure, let's say 50% are female, 50% are male, but then you're also getting the male patients who have male problems, prostate, penis, testicles, etc. So I find it hard to believe that it's actually 50-50 male-female. But that does remind me that when it comes to the prostate exam, because everyone in med school needs to practice prostate exams, right? Guys have different anatomy. Some guys, their prostate is really deep in there. And, you know, I have pretty large hands. I'm like size 8.5 in the OR, 8.5 and 8.
Damn.
And you know, I'd have to like really reach in there to get to the prostate, and some girls who had smaller hands, they'd be like, yeah, I can't, like my finger's only this long, I can't quite get in there. So anyways. I'm a resident physician in internal medicine who has done many 28-hour ICU shifts. I truly wish that we, physicians, the healthcare system, did a better job about educating the public on life support, and the general public was more knowledgeable about what exactly happens in the ICU. It's difficult for many patients who haven't spent time in the ICU to imagine being intubated, hooked up to a ventilator, getting dialysis, and I often imagine that many patients, particularly those who have terminal illness or elderly patients, would not choose these types of life support if they truly understood what was involved. The procedures can be extremely uncomfortable and often do not change the outcome of someone's lifespan or prognosis. So 2 things here. Number 1, 2 books that you should definitely read. One is Being Mortal by Atul Gawande. The second one is When Breath Becomes Air by the late Paul Kalanithi. These are books that are actually recommended on the Med School Insider's reading list up on our website, which you can find here. The second thing is Healthspan versus Lifespan. So obviously we want to be alive and healthy for as long as possible. Healthspan refers to how long you are actually healthy. You're able to do the things you want to do. You're active, you're taking care of your activities of daily living, your ADLs. Lifespan is just how long you're alive. So you can be hooked up to a ventilator, right? You're not actually breathing yourself, you are sedated, etc., but you're still alive. That's your lifespan. There was an article, I think on New York Times a few years ago, about how doctors die differently because they see what all this stuff is, and when given the option, they don't want all the life-saving measures. They don't want to be on a ventilator for weeks, for months, etc. They want to prioritize health span over lifespan. And I think if more people read books like Being Mortal, then they would get it's a difficult read. It like really makes you wrestle with difficult emotions and difficult thoughts. But it's really important, not only for yourself, but also for your loved ones. If we ask about your drug and alcohol use, be honest, we do not give a shit what drugs you use or how much you drink unless you don't tell us, and we find ourselves suddenly trying to play catch up if treating your life-threatening alcohol withdrawal with no notice, or you have a terrible response during anesthesia due to cocaine use you didn't tell us about. Forewarn us so we can take care of you and give you the medication you need. We won't tell the cops or your employer, and we are not judging, but we have to know.
You know, doctor-patient confidentiality.
Very important point. Patient-doctor confidentiality. The healthcare team is not going to be ratting you out to the police or to your employer, etc. We just need to know from a purely health perspective. If someone is an alcoholic and in the hospital they're not getting any alcohol, they will get delirium tremens. They'll get seizures. This can be life-threatening. And I've seen this multiple times when I was rotating on internal medicine as a med student. Although the part about not judging, I mean, let's be real. If you've been in the hospital enough, you're surprised by how much judging there is. Next up, I work as a paramedic in a GP surgery. I think 50% of my job is explaining to people that their illness is viral and antibiotics won't cure it. It is amazing how many people go to the doctor and demand antibiotics. Those doctors that don't have as strong of a will and or maybe just kind of burned out and cynical, they'll say like, whatever, shut up, here are your antibiotics. The younger doctors, the ones who are hopeful that they can make a change in the world, say no. This shit is a cold, it's a flu, it's viral, your antibiotics literally will not do anything. And people will say,
no,
The antibiotics help me.
Just write me a script for Zentrex and I'll be on my way.
No, that's called regression to the mean. You would have gotten better regardless with or without antibiotics, and you taking antibiotics is actually not helping you. In fact, it could be harming you because it's wrecking your gut flora, and I talk about that up in this video here. Another one related to this, fixation on antibiotics is not only wrong, it's also very, very dangerous. Overuse of antibiotics is precisely what leads to antibiotic-resistant bacteria, so don't ever ask for antibiotics for something that can't be treated by antibiotics, such as cold, viruses, etc. And if you do get a proper antibiotic prescription, finish the entire cycle. Not completing the cycle may result in some bacteria surviving and becoming antibiotic resistant. Very important points here. This is already happening. We have a lot of bacteria that are antibiotic resistant, and only certain things will work on them. And then what happens when they are resistant to those few antibiotics we have left, right? Not a good situation. The reason being, when you use antibiotics, there's always a chance that a mutation occurs in the bacteria that gives them resistance to the antibiotic. And then they can proliferate, and of course, they're spreading the antibiotic resistance. Finishing a cycle is also important for the same reason. Oh, our nurse here, just tell us you lost it up your butt. We know you didn't fall on it. We don't care, just tell us the truth. There are so many interesting x-rays you can find online with various objects from toy cars to who knows what else going up people's butts, and it's always the same story that,
Oh, I just slipped and I fell and it went right in.
Sure it did. We have to ask you the same questions over and over again. It's to prevent mistakes, clarify and catch misunderstandings, and protect the patient. Despite the objective, patients tend to get really frustrated when we ask them questions more than once, or that they think we should already know the answer to. Yeah, this is true, and I mean, I've been in the patient role plenty, and I get that it can be kind of annoying, but there are so many medical errors. Like, the hospital and the medical system is actually much more dangerous than people think. If you're in the hospital as an inpatient, as an example, much higher risk of infection. What I'm actually pointing to, more importantly, is medical error. There are so many errors that occur, and being very thorough and checking, double checking things is one way that we can reduce medical errors. I'm an optometrist, and it always amazes me how many patients will go 10+ years between exams just because they feel like their vision is fine. All right, I'm actually guilty of this, where I haven't waited 10 years, but my prescription for my contacts hasn't changed in, I don't know, 7-8 years. And I may or may not have recently gone to the optometrist for an updated prescription and got 2 years of contacts because I knew that after 1 year it would expire, and I don't want to go again after 1 year. Many sight-threatening conditions are easily treated when caught early and won't initially present with any major changes in vision. Also, you don't need a vision plan to have an exam. Yeah, good point. I paid like $130 at Costco to get both contacts and glasses exam and my prescription all set, which is really important. Other diseases, other systemic diseases can actually manifest in the retina, in the eye. I've been working in GI clinical research for 8+ years. Please be comfortable learning and talking about GI health and poop. I would read so many medical records where people ignored symptoms because they were either embarrassed or didn't know that what they were experiencing was something to be concerned about. Everyone poops, don't be embarrassed. What are you talking about? Girls don't poop. Dietitian here. We are not nutritionists, and we don't tell you what you can and can't eat. We are not the food police. We will not give you a meal plan for weight loss when you're in the hospital. We're a part of the whole medical team and provide nutrition prescriptions that include macronutrient goals and micronutrient goals. We provide expertise on feeding the critically ill ICU patients, whether it's through a tube or IV. We provide education of various diets for a wide spectrum of diseases. Our notes are generally very thorough and shed light on patients' recent intake, weight history, food allergies, etc., but seldom do other clinicians read them, which is frustrating. I wish more doctors and nurses value the importance of patients' nutritional health and thus the importance of dietitians in the clinical team. This is a well-known problem in medicine. In most medical schools, they don't spend much time at all on nutrition. So my school, UCSD, was a bit more progressive. We did spend a handful of hours, but it's still only a handful of hours on health, on nutrition. And we had a lot of talks, a lot of lunch talks as well that I attended. That's why I actually experimented with a plant-based diet back in med school. But yeah, obviously there is no magic pill. Things like lifestyle and nutrition are the core foundation. You can't be healthy without those. Simple as that. Speaking of nutrition, that brings me to the sponsor of today's video, Levels. Levels can show you how food affects you in real time with a continuous glucose monitor. It allows you to track your blood sugar automatically minute by minute over the course of the day, and allows you to see how your nutrition choices, your exercise choices, your sleep, your stress all influence your overall blood sugar. I've been using one almost every day now for over a year because I find it that valuable. It holds me accountable, and it actually gives me a lot of valuable insights. So as an example, I learned that if I want to have some ice cream or really craving sweets, I need to get some intense cardio done either before or after to minimize the glucose spike. And if I miss a day at the gym, or I don't sleep enough, or I'm really stressed, or I'm just making poor food choices, then I can't lie to myself. I see it in the actual data. It holds me accountable. It makes me a better version of myself. The old thinking was that blood glucose monitors were only for diabetic patients or pre-diabetic patients, but Levels is changing that and bringing it to the masses. What Levels has created is really awesome. It's really valuable for those who care about health and wellness, and that's why I continue to use them to this day. To learn more about Levels, check out the link here or down in the description. Levels has been a longtime partner of this channel, and I really appreciate them. I think you'll find them valuable as well. Nurse here, please be honest with your healthcare professionals. We can't help you properly if you're not. If meds are prescribed and you find that they give you intolerable side effects, don't stop taking them and not tell us or not mention why you stopped. There are probably alternatives that would be better for you. If you don't, we think you're taking them as prescribed and then have to do something because we don't think it's working. We need to know everything, whether you think it's relevant or not, so that we can decide what needs to be done. You know what's funny? It's just like what your mama told you when you were a little kid. Be honest. I think the reason patients are not honest about being non-adherent or non-compliant with medication prescriptions is that they don't want to be reprimanded. But most healthcare professionals aren't going to reprimand you. They want to understand why it's not working, why you don't want to take it, and then figure out a solution for you, right? As a paramedic, I ask for patient medication lists and I'm often told, you don't need it, the hospital has it. I'm a medical professional with a wide scope of practice. Your meds are essential to me providing proper care. Call a cab if you just want to ride to the hospital. I like that a lot. Yeah, the paramedic is not just an Uber to the hospital, right? They're there to stabilize you and actually get you there safely. So depending on what medications you're actually taking, that tells them what they can and cannot give you. They want to avoid potential dangerous medication interactions and such. RN here, please don't blame us for lack of staff. I work in an outpatient clinic giving chemotherapy, shots, iron infusions, and other meds. Patients get very angry when they have to wait to get their treatment. I understand you're tired and took time off work to make your appointment, but I can't work any faster. We need to make sure your labs are good, you're actually due for treatment, etc. We are extremely careful on administering medication and have to practice safely. We can't be rushed. Being rushed can cause fatal mistakes. Sometimes your treatment may get delayed because nurses have to help a patient who's having a severe allergic reaction to their meds. So many people on the healthcare team, including nurses, are spread so incredibly thin. And the really sad thing is that the nurses are oftentimes on the receiving end of a lot of that negativity from patients. I can relate to the frustration because there are times when I show up to my infusion and I need to wait 30 minutes for my seat, but it's not because they're out there chilling, watching Netflix or whatever. They're busy with a patient. Oh, maybe the patient is having a complication and they can't get to me as soon, right? There are a few places where you really don't want people to rush. One being airplanes, right? You don't want your pilot or the staff that's doing all the various safety checks to be rushing things. Same thing in healthcare. There are so many systems and checklists in place that do take some time, right? But that's in order to minimize errors and keep you safe. Finally, I wish people treated their primary care doctors and nurse practitioners with more respect. Patients act as if PCPs aren't as important because they didn't specialize in one area. However, it's your PCP who has to stay on top of current info for everything, and they're the ones who are going to figure out if you have anything wrong before they send you to a specialist. Also, please stop treating doctors like you're ordering off a fast food menu. Insurance is costly and everyone wants the most out of it. However, you can't walk in and demand specific drugs, treatment, paperwork to be done right away. Your doctor cares about your health and will work with you. Just open yourself up to a real discussion about yourself and your health. You know what's sad? So many patients are so skeptical of doctors for some reason. They think that doctors are in bed with the pharma companies, they're just trying to make money off of me. Doctors just want you to get better. They care about your health. And PCPs, they're the backbone. They're the quarterback of the whole system. They're coordinating everything. I think part of the issue too is with the internet, with Dr. Google, a lot of patients come in thinking that they know what their diagnosis is, what the treatment should be, et cetera, et cetera. And if it was that easy, then why would med school and residency be necessary? Anyways, that's it for this video. Let me know your thoughts with a comment down below. Much love, my friends, and I'll see you guys in the next one.